Hi, everyone, and welcome back to the stage for our closing speaker and remarks. We hope that you have all enjoyed the workshops and panels for today. I'm excited to introduce our closing speaker, the director and co-founder of Berkeley's Biology Scholars Program, Dr. John Matsui. The reason he chose to start BSP is captured by the phrase professional is personal, where his personal background and experiences have driven what he has done professionally. It has been his commitment to make biology at Berkeley accessible to all students. Through BSP, he hopes to level the playing field for individuals who, like himself, do not fit the historical profile of success and to help them become leaders in their future science-related careers. I am honored to welcome Dr. John Matsui.
Good afternoon, everybody. It's my pleasure to be here today. When I was asked to speak, I felt deeply honored. I have for
Hello, John, is your mic working well?
I think so. I'm hearing what's said after it's said.
Oh, I see.
You might have a tab open that is just the stage. So if you want to just close that one and then only have the backstage
There it
stage
goes.
open. Yes, okay, sounds good.
I just closed the tab, and my apologies to everybody at this conference. Some of this technology is new to me, and so I apologize. And so, as I was saying, I really appreciate being here today. I really want to support the effort of the organizers and also all of you at today's conference. But who am I? Let me give you, some of you know me, but I want to give you a little bit of background so you know exactly where I'm coming from. I think as was said, I really do believe in the phrase professional is personal. So I want to talk a little bit about my personal background, which I think has been really influential in terms of the work I've chosen to do at Berkeley and elsewhere. I'm the director of a science equity and inclusion program called the Biology Scholars Program. And this program is at UC Berkeley. And you can see the slide right there. BSP, or the Biology Scholars Program, is a program that I've worked on for many, many years. In fact, longer than some of you have been alive. And what you see in the slide is a subset of individuals in the program. I academically and personally did not do well in high school. And in fact, I was what I call a back row student. The way I was being taught wasn't the way I learned. And because of that, I tuned out. I love science, but I did not love the way in which science was being taught at high school. And so when everybody else was going off to places like UCLA and Berkeley and Harvard and Stanford, I went to a community college. And that was probably the best thing that could have ever happened to me. Because at my community college, Merritt College in Oakland, I learned to learn. And I was inspired by mentors. And so I owe a lot to the community college system. I owe a lot to those individuals who saw the talent, the potential in me. And this personal experience really, really shaped my trajectory as a professional. A lot of luck was involved. I made a lot of mistakes, but individuals actually spotted me and worked with me. And I give my thanks to them. Those who actually did that, otherwise I would not be here today. So in preparation for today's talk, I really, really thought about what would be useful for you, because life is not a conference. After today, you're going to go back to your colleges and universities, and reality will set in. I heard the inspirational keynote speaker this morning. I didn't sit in on any of the workshops, but I'm sure you've been motivated, you've gathered information, you've refined your strategies on how to take the next step in your professional development. But basically what I want to do today is to really give you something to take away, some things that you can actually use. Programs like the Biology Scholars Program, programs, or I would say events like today's conference, are really, really critical. But we do have our critics. We do have individuals who in fact are harshly critical of programs like BSP and also like conferences like this. In fact, in BSP, some of the students are viewed as really not Berkeley material. And by others, they're viewed as individuals who really shouldn't be in the sciences. In fact, my students come from low-income, first-to-college backgrounds. Many of them come from highly under-resourced communities. And because of that, they have not had the opportunities or experience to be prepared, well prepared for the demands of Berkeley. But because my students have worked really, really hard, we beat all expectations. And because I know that most of you are really interested in going into a healthcare career, let me just share a statistic with you. For those of you who are interested in medicine, you probably know already that nationally, of all the applicants in medical school, about half get in. At UC Berkeley, the take rate is about 55%. At BSP, in spite of the fact that my students come in on average with lower SATs and high school GPAs, 85% of the students in BSP who apply to medical school get in. And so it is not about what you bring, but it's about the environment that is provided to you. That environment can either make or break you. And so programs like BSP, conferences like the conference today, are ways to level the playing field. But our critics nonetheless say such things as, well, why not let the cream rise to the top? I take issue with that imagery. Prejudice is a thing of the past. I don't know what world they live in. Isn't science science in any culture? Well, let's think about that. And what does gender and race have to do with practicing medicine? It's science. And some people think if it ain't broke, why fix it? The whole science enterprise in this country and mostly around the world is producing great products. Great discoveries are being made every day, and some people think it isn't broken. But of course, as we know about systemic racism, as we know about institutional bias, the way science is set up today isn't for everybody. Science was not designed with maybe you or me in mind. And so we have to find another way to express our potential and to reach our goals. So typically when somebody gives a talk like this, a boilerplate talk that extols just how wonderful you are, how good you are, how important you are, and assuring you that you can make it, that you can do it. That's typically what people say in these sorts of closing talks. But I wanted to give you more than that. I really believe that encouragement is important, but I wanted to give you some tangible takeaways. So let me give it a shot. Let me see what I can do. Well, first of all, you are wonderful. And I'll just say that up front. And the students in BSP really know that I feel that way about them. And you are here today because people believed in you. People recognized your talent, your potential to succeed. People in your family, your friends, faculty at your colleges and universities, and counselors. And as you move on, as you continue on from college to medical, graduate, professional school, and then finally onto your careers, you will affirm their belief in you. And so you are wonderful. Know that. Secondly, what about the you are important? Why are you so important to not only us, but to science, to medical science, and also to society? If I can have the next slide, please. For me, this is captured by the phrase professional is personal. Your hidden value, your hidden value lies in your different personal experiences that you bring to bear in a professional context. Now, this is beyond the givens of your aptitude, your knowledge, your persistence, and hard work. Those are givens. But your personal experience will inform your professional work as healthcare professionals. And this is something that's overlooked. Healthcare, of course, is more than just health science. And let me illustrate this with a few examples. Next slide, please. One of the examples that I want to bring up is sickle cell anemia. Sickle cell, of course, is the sickling of red blood cells under stress, mainly oxygen, but also emotional stress in certain populations. It is correlated, as you know from your science, from your biology courses, correlated with the distribution, the geographic distribution of malaria. In a malaria area, sickle cell anemia carriers are in fact less likely to get malaria. But those individuals, those carriers, placed under stress, emotional or physical stress, red blood cells sickle and cause death of organs. And so carriers have a real challenge. In the early 1900s, had there been a diversity of biomedical researchers, sickle cell anemia was described for the first time in a peer-reviewed scholarly article in 1910. But 50 years passed between the discovery of the sickle-shaped red blood cells and the onset of sickle cell research. Had there been a greater diversity, mainly had there been individuals whose personal lives were affected by sickle cell, and in this country, it's mainly African Americans, had there been a greater representation at the bench doing science, probably the research would have started sooner. Next slide, please. The birth control pill is another great example of this, a great and sad example. The birth control pill was developed in the 1960s, the oral contraceptive. And in the 1960s, had there been science professionals from diverse backgrounds at its invention, at the invention of the pill, would the pill have been tested on poor indigenous women in Mexico, while such testing on US citizens had been banned? If you have scientists and researchers and medical practitioners who would be more cognizant of populations that are used and abused for the sake of biomedical research, that may have not happened. Next slide, please. And today with COVID, with the inequitable distribution of PPE, as well as the accessibility to the vaccine and quality care, would that uneven distribution exist if we had a greater diversity of not only practicing physicians, but also decision makers and policymakers? My guess is that COVID would have been treated more equitably. The bottom line is that we want you. This is why you're so important. We want you for more than just your science abilities. In medicine, at the bench, in the field, in academia, in public office, in court, and also in industry, your background will matter in terms of the research you will pursue, relevant to which patient populations you will serve, how you will interpret and apply what you learn, and also where you will choose to practice. You will make a profound impact on the inequities and disparities in healthcare. So let me right now take a moment. Let me take a moment and connect diversity to something you will do as a healthcare professional. As a healthcare professional, you're going to be trained to ask good questions. And from those questions, you will formulate hypotheses or explanations for how to address disease, how to treat your patients in a culturally relevant and responsive manner. In short, you're going to be problem solving. That's what good physicians do. So I'm going to take you through a couple of exercises, kind of break up this, talking at you. I'm going to give you a couple of exercises, some problem-solving exercises. And the first involves, problem number one, involves matchsticks. So imagine, you're all familiar with Roman numerals. Imagine that these Roman numerals, 1 through 12, have been created using matchsticks. Next slide, please. So here's the challenge. Here's the problem. Imagine this. You approach a table in the middle of an empty room. As you look down at the surface of the table, you see matchsticks. I'll show you a picture of that in just a second. You see matchsticks arranged to make an equation using Roman numerals and arithmetic symbols. But the equation is false. And here's the problem. What is the fewest number of matchsticks that you can move to make the equation true? Next slide, please. Here's what you see. So again, you're approaching a table, and on that table is this equation made out of matchsticks, but it's a false equation. It's an empty room. How many matchsticks do you need to move in order to make this equation true? I'm going to give you a minute here to think about that. What's the minimum number of matchsticks that you can move to make this equation true? Next slide, please. The answer is none. You do not have to move any of these matchsticks to make the equation true. Let me show you this. Next slide. How do you make this equation true without moving any matchsticks? So here's what you see first. Here's what you see as you enter this empty room with matchsticks on the table. Next slide, please. Let's say that you move around the table. Next slide, please. To the other side. That is a true equation. 10 equals 9 plus 1. Now, you may say that's a trick question. We'll talk about this when I talk about the relevance to what you're going to be doing as practicing healthcare professionals. Let's go to the next slide. Problem number 2. Next slide, please. So this is an actual interview question that was used at Google. And what they're doing right here is they're giving you a sequence of 2, 4, 5 numbers. And they're asking you in this sequence of numbers, what is the next number in that sequence and why? And they're giving you 5 choices. Take a moment and think about which choice, A through E, is the next number. Next slide, please. And the answer is 13. Next slide, please. Take a look at that. Take a look at that. Why is 13 the next number in that sequence? Some of you who are more mathematically inclined, you were probably going through all sorts of computations, looking at relationships, quantitative relationships, and so on. But the answer lies in not looking at the numbers this way, but next slide, please. But the numbers spelled out. Now, what's the series here? What is the series here? Well, if you take a look at starting with 2, how many letters does 2 have? The word 2. It has 3 letters. 9 has 4, 60 has 5, 20, 6, 15, 7, and 13 has 8 letters. And so what's my point here? I mean, these may be fun questions and everything, but basically the takeaway is that on the street, at the bench, and probably in the exam room, your individual and personal experiences and perspectives are going to all affect the way you go about problem solving, how you see a problem, and how you look for solutions to that problem. And in your case, you're looking for a diagnosis, you're looking for a cause, you're looking for a reason, and therefore an intervention to help make the person healthier. Our personal experience, our insights, the different ways in which we take a look at the world and interact with the world really come from a very personal and experiential place. And this makes the really strong argument for individuals with diverse backgrounds and experiences being part of all of our institutions. And that includes in the classroom, in the laboratory, and in your case, in the exam room, in the medical exam room. And so STEM needs diversity. And more specifically, in the case of your interest, we're talking about diversity in healthcare. So the final thing, what about the you can do it part of my speech? Okay, so this is the third part. You can do it. Beyond your aptitude, persistence, and hard work, what will determine whether or not you will achieve your goal of becoming a healthcare provider? All of these things, the hard work, the aptitude, the persistence, all of that, these things are necessary, but they're not sufficient. It takes more than that. Next slide, please. And this is something that you already know. So I apologize for telling you something that is really deep in your bones, and you know this. But none of us succeeds alone. It takes a village. And so who's in your corner is going to matter in terms of how far you're able to express your potential, how close you will come to realizing your personal and professional goals. So by who's in your corner, I'm talking about family members, friends, teachers, counselors, and other sorts of mentors and advisors. And critical in this is your choice of to whom to listen and with whom to work. And so what I'm going to do right now, based upon my many years of working with pre-health students interested in going into the healthcare professions, I'm going to give you 4 categories of advocates or anti-advocates that I've identified over the years. Next slide, please. So the you can do it part, the advocates and anti-advocates. And so this is something that I think, please, if you don't take away anything else from my talk today, really think about this. Mentors are absolutely critical. And so the first category, here we're talking about cheerleaders. These are individuals who are solidly in your corner. They are encouraging you. They are emotionally supporting you. They celebrate with you, but they also cry with you. They say to you, you can do it. Follow your dreams. Cheerleaders have good intentions, but they may not have enough of the specifics to tell you how to make it, but they're there for you. And God bless them. They're there for you. I'm the first in my family to go to college. Some of my family were cheerleaders, but they couldn't help me succeed in college and STEM at college. But they were there emotionally for me. Cheerleaders are important. We need them. But in terms of their support, it's mostly emotional and psychological without any of the how-tos. The next category that I identified are the gatekeepers. These are all too familiar to many of us. Gatekeepers say the following: no, you can't, it's impossible, and you expect to do this? Gatekeepers will judge you based upon very little information about you. They will tell you what to do based upon very few data points. For example, I've had some of my students talk to advisors, academic advisors, who would say, oh, you got a C in general chemistry and first semester organic chemistry, and you want to do medicine? You should choose another career goal more suited for your aptitude and ability. Now, that's bad science. 2 data points early on in the development and the academic career of a student. The advisor knew very little else. What was the story behind those 2 C's? Was the individual working a whole lot? Were they having family issues? What about health issues? What contributed to that? Maybe their their chemistry, the last chemistry course that they had was in the 10th grade, taught by somebody who read out of the chemistry textbook and didn't prepare them well for the expectations and challenges of university level chemistry. And so gatekeepers feel like they're doing their job because they feel like they're doing you a favor by telling you early on what you can and can't do with very little information. Beware of the gatekeepers, and I'm sure you've run into them. The next category is what I call the mercenaries. These are the most insidious individuals because your presence is their gain. They will count you. They will want you in their program. They will want to say that they worked with you simply because they're keeping score of how many Black students, how many brown students, how many low-income students, without really having your history in mind, knowing enough about you, or having your welfare in mind. But they want to count you. Mercenaries are all around us, especially nowadays when people are talking about systemic racism and righting social injustice and so on. People may want to jump on that bandwagon and simply count you because you're the right color, you're the right gender, and so on. Be aware that there are mercenaries. The final category, and the 4th category, is what I call the coaches. The coaches. Coaches, probably some of you played sports, probably some of you did performing arts, maybe some of you did debate. You had coaches. And you know that good coaches are hard to come by because a good coach does the following. The good coach assesses where you are, finds out from you where you want to be, and then develops an individualized plan on how you can get there. A good coach is like a personal trainer. I would say a good mentor is a good coach. They really do see you. They ask you a lot of questions. They do more listening than talking. And because of that, they really do get to know you. One size does not fit all because plan A that works for somebody else isn't the same as maybe the plan that you need in order to reach your goals. Good coaches will tailor, they'll individualize, they'll deal with you in good and bad times. They will help you re-strategize in the face of failure. But how do you know whom to choose? How do you know whom to select? To whom you should be listening? There are no guaranteed, formulas, but I have some consumer guidelines because you are shopping for mentors. And so here are some of my recommendations. Be skeptical. That is to say, simply because something appears good at first, your relationship with a potential mentor, I want you to be skeptical, which means to say, I don't know yet. I need more interaction. I need more time. I need to see how we react to one another in good times and in bad times. And you know how it is. You know how it is. It's like with friends. When things are good, everybody's your friend, but you find out who your true friend is when things don't go well. A good mentor should be there by your side in good times and bad times. They need to be authentic, but they also need to be supportive and not reinforce this idea of perfectionism. If you don't do it 100% well all the time, I don't want to work with you. No, no, no. Many of us are reaching very high, and we will fall, we will fail, but a good mentor will be there with us to re-strategize, reshape our plan to move ahead. So don't rush to judgment. Question the basis also for his or her advice. Is it for their interest, or is it really with your interest in mind? And under what circumstances? Is it just during the good times? Is this person a mentor, or is it at all times? And also the fit between who they are and who you are. And one of the mistakes that I think people make is to think that a good mentor has to be exactly like you. You can have multiple mentors that actually help in your relationship with them different aspects of you. Some of my best mentors have not come from the same background, ethnic background, or socioeconomic background as me, but they helped me with things that they could help me with. Whereas others I turned to because I wanted somebody to understand what it means to be from my socioeconomic, cultural background. And so multiple mentoring is really, really important. So I want to close this right now with the next slide, please. 2 quotes. Never forget where you've come from. And it's not about how you start, but it's about how you finish. Of course, we should never forget where we've come from. This is if professional is personal, where we've come from makes all the difference in the world. Some of us are viewed as a bundle of deficits because we don't come from privilege, because we don't come from advantage, because we don't come from neighborhoods that are considered to be desirable. Those are all aspects of who we are, and we should never forget that. Those aspects of how we grew up, where we grew up, the type of food we eat, the type of music we listen to, what our first language is, all those things are part of who we are. And those things will translate into the type of professional we will be. And it's not about how you start, but it's about how you finish. Where I grew up in the flats of West Berkeley, low income, first to college background, where most of my friends that I ran with weren't expected to and never did reach college. And if I can have the next slide, please. Here's a picture of me in 2015 in the Oval Office of the White House, receiving an award, a mentoring award in STEM from then President Barack Obama. It is a moment that I will never, ever forget. And I still feel very emotional about that. But I never expected myself to ever be in the presence of a wonderful, great human being like Obama in the White House, receiving the highest STEM mentoring award that could be conferred upon a civilian. And so I want to right now say to you, it's wonderful that you're here today. And hopefully what I've said in these past few minutes has been helpful. We have big challenges in front of us, some of us more than others. But this is a work for all of us, for you, your families, your friends, and the communities that you will someday serve. So what I want to do right now is to thank you for your time. And next slide, please. Next slide, please. And I want to be able to take your questions. So thank you very much. Thank you.
Thank you so much, John. That was really inspiring, and I feel really motivated, especially I feel like a lot of people I see in the chat are feeling also really motivated. And if anyone has any
Thank you.
questions at all, please send them in the Q&A or the chat. And Heather, if you can stop screen sharing.
Thank you.
Yes, I do have
So
a question.
please. Yes.
Right now at the university that we're at, UC Berkeley, for a lot of pre-med students and pre-health students, we don't have a lot of support. And how are you going about with other organizers to get the support we need, or to reflect the support you give us through BSP and other on-campus departments?
Over the last 5 years, I've actually, I received a big grant from the Howard Hughes Medical Institute. And that's the grant that helped support BSP over the last 5 years. But also a part of the grant was to take what we've learned in BSP and to share what we've learned with the rest of the campus, with advisors, with faculty, with grad students, so that they would be better mentors, teachers, and research and advisors. And so there are about 200 unique individuals from Berkeley that actually participated in those teaching, mentoring, and research workshops. So, this is one of the things. But what the university needs to do, it needs to step up. It needs to reward inclusion and inclusive excellence. It needs to reward changes in behavior that make Berkeley a place not for all of the students, not just some of the students. Because what historically Berkeley has been set up, and probably most of the institutions that you all are from at this conference, institutions are typically set up to support students who fit the profile of the historically successful. Berkeley has a lot of changing to do. Berkeley has a lot of work to do, as do most institutions. So at a local level, that's what we've been doing with the Howard Hughes Medical Institute money, trying to spread the best practices of BSP campus-wide to change the institution. And this is called inclusive excellence, as I've said. We need to fix the institution and not the students. Students aren't broken. The institution is broken. And this is the message that I've been trying to convey. Nationally, I've been working with the National Institutes of Health and the Howard Hughes Medical Institute, and also the National Science Foundation to get this message out around institutional change. And just relating it back to Black Lives Matter and all the killings that have been going on and the injustice that has never ever gone away, but is being noticed even more so now. This is about systemic racism. This is about institutional change. This is about what's wrong with our institutions, not the individuals who are on the negative receiving end of institutional practices and policies. So thank you for asking that question.
Thank you so much for your response. There was another question in the chat. Someone asked, could you please tell more about the Biology Scholars Program? And I think they mean in terms of the application process, but also the other resources that are open to them.
So maybe you can speak about that as a BSP member.
Yes, I've been a BSP member for about 2 years now. And the application process was pretty accessible. It's just a regular application, and then you're called in for an interview. I believe they had mock virtual interviews last semester. So yes, so as soon as the application is open, you apply, and then you're called in for an interview. And the interview is really one of the best interviews I've ever had. It was really comfortable, and I didn't feel so stressed out because it was just me talking about my experiences, not trying to I was able to be myself, especially as like a freshman, sophomore that was kind of shy. It was really accessible. And the different resources that are open to you are study groups. We have a test bank that everyone has access to. So those study groups are really small, so you get really one-on-one help with everything. You also have access to peer advisors, but also staff advisors. So anything from 4-year plans to can you read my resume? Recently, I had a mock interview with Mario, one of our advisors. It was awesome. So there's so many different things you can access BSP for. And if you want any more information, I could definitely link the website in the chat. So thank you so much for that question. I hope that kind of answered a good amount.
And and one thing that I think is really, really special are the students in BSP.
Yes.
We select students because of their passion for science, but also their commitment to service, commitment to their own individual success, but the commitment to the success of others in the program. And so it's a family that mutually supports one another. And you know this already because BSPers help each other out. And the alums that have graduated from the program are reaching back to give seminars about what medical school is like, how to apply to medical school, all those sorts of things.
Yes. Yeah.
So it's like BSP for life.
It's a really, really big community, and I do recommend everyone. Recently, we had a post-bac panel. We had different panels with different alumni, and I remember being in the study in the BSP room studying for the Chem 1A final, and those are memories that I'll never forget, even though it was all the way in freshman year. So it's a huge family, and it feels different than other on-campus departments. I would say it's for your professional development, but it's also making your professional personal. So I think it's a really important organization and program.
Good description, really good description.
Thank you. And then there is a second question in here from, let's see, sorry, scrolling up. Iris, yeah. What advice do you have for college seniors who are finishing their last semesters?
Yeah. So let me just acknowledge that graduation is a really, really big deal. You know, it should be all about celebration and everything like that, but we have mixed feelings because just think about it. All these years you've been in school. You've always known what the next step is because that was the next grade. Going from elementary to middle to high school, then to college, undergraduate. What you're entering right now is the unknown. The ideal situation in some people's minds is actually having your after graduation already planned out and everything transitioning smoothly from being an undergraduate to, for example, being in dental school or medical school or whatever. Life doesn't work that way. Life doesn't work that way. And so what you're left to right now is you're left to constructing your own next steps. And the next steps for you aren't necessarily the same as the next steps for the person next to you because it has to be individually tailored. And so what I would do is to, first of all, not rush and to think like you have to be like everybody else. And don't call it a gap year. This is a growth year. Call it a growth year because what that year will allow you, or 2 years will allow you, is to grow in terms of your understanding of why medicine or why dentistry or why pharmacy. Have experiences, allow yourself to develop, and also allow yourself then to transition through taking the standardized test, whether it be the DAT, the MCAT, or whatever, at a time when you're ready. Not because other people are taking it when they're taking it, but because you're ready to take it. So get the experiences, get the growth, and timing is a whole lot. It matters in terms of your success. And so think about it in that way. Think about it as something really personal and not something where you have to do what everybody else is doing. Because the notion of falling behind and not keeping up with your cohort, with your class, I would say you have to kind of take a step back and really treat yourself as you would a loved one and say, okay, let's think about this. Let's work with this. Let's develop a plan and do this with an advisor like Mario, or do this with somebody that you can, and that's why mentors are so important. so that you will have a plan that really works for you. And
Mhm.
it's not designed based on somebody else's life, but based on your life. That's what I would advise.
Yes, thank you for answering that question so thoroughly. And I think that's advice you've given me before too, just to make my plan my own. So really appreciate you
Yes.
sharing that with everyone. Maddie has another question in the chat. She says, how do you see an efficiently inclusive and supportive environment changing the concept of imposter syndrome in institutions such as Berkeley? Especially
Yes.
since imposter syndrome is so demographically and socially perpetuated in academic performance.
Yes. Absolutely. So no matter the environment, imposter syndrome really will never go away. So that's the bad news right there. I just want to get that out front because all of us have doubts about ourselves, and these doubts come from various messages that we continue to get from our environment. The university may become completely supportive, but still society needs a lot of work. What does a supportive university look like? An inclusive university will have a consistent message at both the macro and the micro level. There'll be macro affirmations and micro affirmations. Because right now at UC Berkeley, you have an ambiguous situation, and at most of our institutions, you have macro affirmations like excellence and diversity, right? That's the billboard, excellence and diversity. But then you get all these microaggressions that are happening when you're trying to pair up with somebody in your lab section, when somebody won't study with you because they're assuming that you're not smart enough, that there are all these, and when you say you want to major in STEM and they don't believe you because people like you don't major in STEM. And so an inclusive, supportive university where imposter syndrome is less likely to play out, there's going to be consistency and not ambiguity in what the university says and what actually happens in each and every individual interaction, whether that be among students, between a student and advisor, between a student and a TA, between a student and a faculty member. Now, that's a long way off. So what we need to develop are counter spaces or safe spaces, as some people call them. BSP is a safe space. I will never tell a student, you are thinking about majoring in STEM? See, that's a microaggression right there. Rather than saying, okay, so let's work together. Let's realize that goal. What's your starting point? What do we need to do? Oh, you had a really bad chemistry course in high school. Well, maybe you need to do pre-chemistry because you want to go into general chemistry strong. You're not a deficit, but your preparation doesn't meet the expectation of the university. So let's work on that. Let's close that gap.
Mhm.
So rather than me saying, well, people like you don't do well in general chemistry, so choose something else. So I think that that the institution and most of our institutions have a lot of work to do to align what happens at the macro level, that is the public facing level, and the micro level, the day-to-day interactions.
Mhm.
I hope that helps answer your questions. But find those safe spaces
Mhm.
because they exist on campus. Ask other students, gather together, form your own safe space
Mhm.
where you can check out what just happened to you because it's probably happened to others. Talk about it and know it's not about you, but it's about the institution.
Mhm. Thank you for that. Yes, because as MIH, we are comprised of different orgs that serve minorities, and we seek to act as spaces. So thank you for mentioning that.
Of course.
We have some questions in the Q&A tab. Kayla asks, what advice do you have for high schoolers who are trying to find a mentor?
Yeah. Use your network.
Mhm.
You know how the student network is. They will tell you, for example, and I'll circle back to mentors, but who the good teachers are, who the good advisors are. But remember now, who's good for one person may not be good for you. You have to kind of weigh those things. But usually the word is out about who will support you in a way that is going to really where they actually see you, hear you, and actually have your welfare in mind. So begin with your social network and really, find out, especially talk to individuals who are older than you, because that near peer relationship is important. That's one of the pieces that's so rich about BSP, right? The alums are reaching back to the seniors who are reaching back to the juniors and so on. So you have this whole chain of information going across all the years. So in high school, maybe talk to some of the students who are older than yourself. If there is a trusted mentor in the form of a staff person or a faculty person, maybe they know of others that to whom they can refer you. And so use those networks, And remember, be a smart consumer. If something doesn't feel right, it probably isn't right. Okay? If something isn't right, it probably is going to feel wrong.
Mhm.
But give things a chance. Give things a chance, because everybody has an off day. Circumstances may change, but really, it's both heart and mind that has to line up for you to make a choice of a good mentor.
Mhm. Yeah, thank you for that. I hope that helped, Kayla. And moving on to the next question, how do you advise letting individuals slash organizations who you identify as mercenaries know that you do not want to participate without burning a bridge?
It's a line you have to walk. So you've asked a very political question because you realize the power dynamic, right? Because some of these organizations, some of these programs, some of these individuals may have power to affect your future. And so what you have to do is, if you're forced to be in that relationship, then you have to really keep your guard up all the time. You will have to learn about the system and how to get what you need without the relationship hurting you. It almost sounds like a dysfunctional personal relationship, doesn't it? It really does. But this is about learning the system, learning how to engage the system in a way that is beneficial to you while minimizing the harm to you. It's not a perfect world, and you know this. I'm telling all of you this. Life is hard, and the way the university, the way these systems are set up, I mean, it's just all part of life. And so this is about learning to read systems and to learn to engage with the system in a way that you're going to get what you want. You should not be deprived of what you want and need, yet minimizing the damage that's being done to you in that system. If it continues to do severe damage, then you need to file a complaint or you need to step outside of that situation. Okay? But to try to negotiate that relationship in a way, because this is really, really, really necessary for you all as you're going to move on to become professionals, because the systems are stacked already. I mean, as you go into healthcare, as you go into whatever you choose to go into, systems have biases built in, and you're going to have to learn how to navigate those systems. And so start practicing right now. And don't think it's about you. See, that's the thing. That's what's so insidious about systems. If you feel wrong, or I should say, if it isn't working out, you feel like you're to blame. You're blaming yourself. Really understand the bias built into systems and how to navigate that. Learn to do that now so you can do that later more effectively as a healthcare professional.
Thank you. And I saw that Jaden asked a question in the chat that was kind of similar to Kayla. I am a graduating high school senior. I'm leaving a medical academy. How can I
Yes.
seek coaches to help me with my first year of college?
So you're going to have to do your homework, Jaden. You're going to have to find out what exists at the receiving college that you're going to be going to. The best way is to maybe look for student orgs that in fact, align with your values, your values as an individual and your cultural values and so on, and talk to some of the students and get a preview of what it might be like and really talk to them. So tap into that student network. And I know that many colleges and universities have outreach and orientation programs, and a lot of the student orgs are heavily play a role in that. Isn't that true? Yeah. And so really tap into that. Try to visit if you can. I mean, I know during this time of COVID, the visitation may have to be virtual, but try to get as much information beforehand before arriving on campus. Tap into those systems of support.
Perfect, thank you. And Samantha asked in the chat, and I guess this also goes around the future of BSP in the pandemic
Yes.
era. When will the applications for BSP open again? Will they be allowing applications for next year?
So hopefully yes. But what I'm doing is I'm putting on looking at this through a public health lens, in terms of the health and well-being of our staff, because right now our staff is being pushed to the limit because we're trying to maintain the quality of service to our current students. And if we were to admit more students, we would have to see how that affects the quality of the program. And so let's see how the fall rolls out, okay? And I want science and evidence to drive our decision, because if in fact, the pandemic subsides, we can have more in person safely, and the demands of being online and so on begin to reduce, then maybe we can begin to enroll new members into the program. So I'm not saying no, but I'm explaining my rationale.
But yeah, I linked the website in the chat, so just follow the website and it'll be updated as the applications open up. Yeah.
Yes, thanks.
If anyone else has any other questions, you can go ahead and send them through. But I have one personally. So
Sure.
I recently learned that I'm not really good at maintaining mentors and like mentorship. So what's your advice for maintaining mentorship and also seeking it as a college student?
Mm-hmm. So mentor-mentee, that's a relationship. And oftentimes, and just think about relationships in general, sometimes the expectation isn't clearly stated. Okay? What's the relationship going to be? How frequently? Who's going to initiate? What's if I don't contact, are you going to try to find me? I think that a good mentor-mentee relationship, like any good relationship, there's got to be open lines of communication, including at the beginning, the expectations. How frequently are we going to be meeting? Who's going to the interaction will that take? Will it be virtual? Will it be in person? Those sorts of things. What are you comfortable working with me on? What am I comfortable telling you about? Those sorts of negotiations are really, really critical. And so to be really clear with each other about what the expectations are about each other and your own expectations for yourself in that relationship. What do you want? What do you expect? I think to put all those things out earlier rather than later when somebody goes, well, I thought you were going to contact me. I've been waiting. It's been 2 weeks. But if it's really clear from the beginning who's to contact whom and under what conditions about what, it's much better. So maintaining that mentor-mentee relationship does take work, but the expectations at the front end, I think, will make it a lot easier throughout.
That thorough response. We are at the 5-minute mark. If you have any last minute questions, please send them in the chat. But if not, I'll ask another one of my questions.
Please, go ahead.
Yes, so I'm blanking. What was I
Take your time.
Oh, yeah. So as we all witnessed today, you are really amazing at expressing yourself and presenting yourself
Oh,
in a really nice way. So I was wondering if you have any advice for those that are about to start doing interviews, start doing presentations to large groups of people. How can we effectively express and present ourselves?
so I think a first principle is focus on expressing, not on impressing. Okay. Sometimes we worry more about the impression that we're going to give. It's kind of like the difference between speaking one on one to a person versus writing them. In writing, we tend to censor ourselves. We think about, wow, maybe that isn't a sophisticated enough word, you know, and we get all fancy, we get formal, and we lose the content. We lose the meaning, we lose the feeling.
Mhm.
So, my first bit of advice is focus on expressing rather than impressing when you give a talk, when you do your interview.
Mhm.
Second thing, you got to do your homework. You got to prepare. And I mean reading from cards, but what I mean is you have to really think through what are that you want people to register with people, whether it be a
Mhm.
talk, an interview. And once you identify those outcomes, you can begin to build a conversation, a presentation, an interview in an appropriate way. And you can prepare in that way.
Mhm.
For the interview, you should really know everything that you've written, okay?
Mhm.
Because if it's an open file, okay, they will have read everything, and they may ask you about one thing. You know, in the spring of such and such, what happened? And if you go, wait, I don't remember the spring of such and such. But know what you put into your application. If it is a closed file, which means that they haven't looked at your application, then it's going to be, well, tell us about yourself. And you better know what you said in that file because they're going to circle back and there has to be an alignment. And they're going to say, wow, what that person just said isn't anything like what they wrote. Why is that? Okay. So do your homework, um, express versus impress, identify the takeaways, and then work backwards. Those are the three things that I would say.
Thank you so much. That's really
You're
helpful.
welcome.
And I'll probably make an appointment with you later to talk
Of
more about it.
course.
So
Of
thank you.
course.
And if you would like to send your email in the chat, if it's okay, just to in case anyone wants to connect afterwards.
Let me
Um,
see if I can do this.
mhm. Or I can go
So
ahead
it
and
was,
send it later as well.
yeah. Yeah. Why don't you do that?
Okay,
Why don't you
perfect.
do that? And not let my ineptness with technology slow things down here. Okay.
But thank you so much again, Dr. John Matsui, for coming to talk to us and answering all of our questions. We really appreciate it. And we will now segue into the next part of our program. Yeah. Before
Thank
we
you
close,
all very much.
thank you. Thank you, John.